Talking about the intellectual disabilities also regarded as having the low IQs and the lack of the adaptive functioning. Now, there are a lot of clinical syndromes that are related to such lack of the intellect, such limitations of the intellect, as well as the limitations of the adaptive functioning in the life of the individual. So we can relate these clinical features of having a low IQ or the lack of the adaptive functioning, the lack of reasoning, the lack of problem solving with a lot of spectrum disorders that are basically characterized as syndromic babies. So all of these syndromes will be discussed over here in this section. We will be discussing the Down syndrome, which is particularly characterized with the low IQ, the lack of the adaptive functioning, peculiar facial features are seen in these babies, and then we have the autistic spectrum disorder. So this is basically known as the autistic spectrum disorder. The word spectrum is added to this kind of a syndrome. Why does this happen? Because it has a wide range of clinical features attached to it. One patient is not similar to the other patient who is suffering from the same autism. So this is basically why we characterize them as suffering from ASDs, or which are also known as the autistic spectrum disorders. And then we have the Prader-Willi syndromes, we have the Fragile X syndromes. All of these syndromes, what is common among these syndromes is basically the genetic abnormalities that are related and that are basically resulting in these kind of clinical syndromes again. So basically we have to focus on this fact that the genetic involvement is very important whenever we are calculating the IQ of this particular individual. The genetics, basically the low IQ or the high IQ, it runs in the families of that particular individual. So all of these will be discussed over here in this section. Talking about the epidemiology, 0.7% of the general population is involved. White paper valuing almost 210,000 people in UK have severe or profound ID. So this is the epidemiology that is related to the intellectual disabilities. So this is quite an underrated problem. 1.2 million people have mild to moderate varieties of this intellectual disabilities. So the age of enlightenment is basically the age of getting the awareness towards the general population, giving the insight towards the general population, because a lot of people have been suffering from these intellectual disabilities. They have the right to basically have their hands on the normal opportunities in their lives. And how can we get these people to be more beneficial, to be more fruitful to the communities is the work that has been done in the past decades. The diagnosis again is very important. We have the milder forms of intellectual disabilities are usually never diagnosed. So the early developmental delays, there are the milestones over here. If the child is not achieving the milestones properly, we have to assess, we have to get the child assessed from the clinician to get to know more, or to get to know, or to get to have a better knowledge about the intellectual disability of the child. The difficulty in feeding is quite commonly seen in such individuals. Then we have an abnormal muscle tone in these babies as well. They're usually suffering from the physical anomalies, and the behavioral phenotype is also going to be seen. For example, behavioral phenotype basically is a term which is used for repetitive behavior if it is seen in an individual. It can range from the biting phenomena, hand biting, hand fondling, all of these phenomena, wringing of the hands, all of these phenomena basically they categorize in the behavioral phenotype of this particular individual. Usually a particular behavior is suggestive of a particular syndrome. So this is basically what we focus on over here. Talking about the Down syndrome, the epidemiology resulted is in 1 in 700 to 1,000 live births. The trisomy of chromosome 21 is again very important over here. This is basically what is resulting in the Down syndrome. Due to the primary disconjunction during the meiosis, which is related to the maternal age. The translocations and the mosaicisms are sometimes seen at the genetic level. A lot of researches have been carried out, and they have basically revealed this trisomy phenomena, this primary disjunction, translocations, and mosaicism. 15% have the milder intellectual disabilities, and while the rest have the severe forms of the intellectual disabilities as well. We have the clinical features ranging from the impairment of the physical development, which is basically resulting in the congenital heart disease as well as the hypothyroidism and the particular facial features of that individual. Then we have the psychiatric comorbidities seen in the Down syndrome, which is basically the attention deficit hyperactivity syndrome. And then we have the depression, conduct disorders are seen in these children, and dementia is a very important feature, which is seen in the children who are suffering from Down syndrome. Then we have the amyloid precursor gene protein. There's an overproduction of beta amyloid, which is going to result in a low blood pressure and a low risk of atheroma. So this additional factor is basically giving the time for the children who are suffering from Down syndrome to lead a longer life than the other children who are suffering from the different other kinds of syndromes, because it's again a protective factor. The overproduction of beta amyloid is basically a protective factor for the child, because the child is basically not at an increased risk of the atheromas or high blood pressure. Then we have another syndrome, which is known as the autistic spectrum disorder. When we look at this autistic spectrum disorder, the core clinical symptoms are the language impairment along with the social deficits, the mood, sleep, anxiety disorders are going to be seen in these individuals, cognitive deficits are going to be seen. There are going to be the repetitive behaviors in these individuals as well. Then these children can be suffering from the attention deficit hyperactivity disorders. Seizures are quite common. Then we have irritability, which is characterized by aggression, and even the self-aggression, which is relating to the self-harm or the deliberate self-harm behavior in these individuals. The autistic spectrum disorder is a pervasive disorder that is present in the early childhood and is persistent throughout life. It is combined frequency of all the autistic spectrum disorders around 1%, and the challenging behavior or the aggressive behavior, self-aggressions, are noted down in these individuals. Defining the Prader-Willi syndrome, it is a genetically expressed disorder that results from the absence of expression of one or more genes, either paternal or maternal, on chromosome number 51. These are the characteristic features that are seen, that is the narrow temple distance and the nasal bridge. Almond-shaped eyes, that is the mild strabismus, is seen in these individuals. We have the upper lip, that is downturned mouth, is seen, and then the patients are overweight as well. So these are the characteristic facial expressions or the facial features, the physical features seen in these people who are suffering from Prader-Willi syndrome. The major criteria for this syndrome is the characteristic facial features, the bifrontal diameter, strabismus, thin upper lip, developmental delays are noted, feeding problems are seen, hypoplastic labia minora and clitoris, infantile central hypotonia, and rapid weight gain between 1 and 6 years of age. Then we have the minor criteria, which basically depends upon the decreased fetal movements, esotropia, myopia, hypopigmentation, narrow hands with straight ulnar border, short stature, skin picking, sleep disturbances are seen, small hands and feet, speech articulation defects, thick viscous saliva, and typical behavioral problems. So these are the characteristic features of the Prader-Willi syndrome that are seen in these individuals. Talking about the Fragile X syndrome, we have a broad head, elongated face, large prominent ears, strabismus, highly arched palate, hyperextensible joints, hand calluses. Then we have pectus excavatum, mitral valve prolapse, hypotonia, soft fleshy skin, enlarged testicles, flat feet, and seizures. Now this is basically the whole criteria, which is basically encompassing the clinical features that are related to the Fragile X syndrome, and obviously a low IQ is seen in these individuals, which is also evident in the adaptive behavior of the individual. The commonest inherited cause of ID, the X-linked dominant variable expressivity, is seen in these individuals. The males are more predominant to it, 1 in 3,500, and in females it is almost 1 in 4,000. The mutations on the FMR1 genes are responsible for the development of this Fragile X syndrome. We have the CGG repeats. So this is the genetic mutation that happens. It is more than 200, but lesser numbers can cause symptoms, often with a normal IQ. IQ is normal to the moderate, or it can be severe and can be mild as well. There are developmental delays, specific facial features, autistic features, stereotypical movements, for example, hand wringing, hand biting are seen. There's going to be an aggressive behavior seen in these children. Social anxiety or antisocial behavior is observed, along with the attention deficit hyperactivity syndrome. Seizures are seen also in these individuals. So over here, we basically summarized all the clinical syndromes that can be related to a low IQ as well as a lack of the adaptive functioning. So that is the end of this section. Thank you for watching sqadia.com.